I'm here today with Jason Gorenstein, who's an urban Zen integrated therapist, also a yoga and meditation instructor in Los Angeles. Hi, Jason.
Hey, Olga, how are you doing?
Doing good.
Good.
We're here today to talk a little bit about how Jason has been using his teachings in helping pre-surgical and post-surgical patients. You've been working with UCLA as a volunteer.
Yes.
Tell us a little bit about that.
Oh, perfect. So, well, thank you so much for having me. I want to start there. Yeah, it's pretty amazing. So actually about, I would say 3 or 4 months ago, I started practicing this urban Zen integrative therapy practice. And right now I'm actually working with patients at UCLA, transplant patients, pre and post surgery, for recovery, for dealing with anxiety, for dealing with pain, and trying to establish a sense of general wellness in the hospital.
That's amazing. And I thought, for the community, that Jason would be a really great asset to be able to help some of you who are pre-op, who can help with some anxiety issues. Tell them how pre-op you can help them maybe.
Absolutely. So a lot of times in dealing with surgery, there's a lot of anxiety. A lot of possibility of what is known and what's unknown.
Right.
And the possibility that when you have this surgery that things are going to be different after that. We don't know. Mm-hmm. But the concept of working with these practices is through these wellness approaches, it makes it easier and more relatable for the patient so that they're able to move forward through the surgery, move forward in their lives, and ultimately be positive and learn how to deal with, what's to come.
Right. So it's what we would consider like a traumatic kind of experience, going into surgery. I think with the fears of, post-surgery, the unknown is extremely, a topic that I hear a lot within my community, and finding out what we can do to calm ourselves down. So can you give me just a little bit of a rundown of what you would do if someone wanted to, start this process and becoming more calm before surgery?
Absolutely. So one of the things that I would say is to start by taking a deep breath. Mm-hmm. So we start by taking a deep breath, and that allows for us to come into the present moment. And the reason why that's important is because through being in the present moment, we can learn how to address the symptoms that we're experiencing right now. So with anxiety, we may say, take a couple of deep breaths, start to notice what is still in this moment. Maybe notice your feet on the ground, feel the bottoms of your feet, notice your legs, and just notice how your legs keep you grounded to the ground. So working with just some simple techniques like that can drastically change the person's perspective of how am I going to deal with this? How am I going to move forward?